Good evening to everyone, and welcome to the Pulse of Practice webinar series. My name is Nathaniel Tsibata, and I'll be your host this evening. A warm welcome to all our students and guests. We have clinical associate students from Wits University, the University of Cape Pretoria, that is, University of Pretoria, and the University, also City University. The whole trifecta is here with us today. Today, we are having our second webinar of the monthly series. These online sessions will be held monthly on the last Monday of every month. The aim for these sessions is to empower students to be able to be aware of the diversity of workplaces for clinical associates, have their questions answered, of course, because we're here for the Q&A and everybody wants to know about the profession. We're here for all of that. And then also to just bring together the graduates, the alumni, and the students around the community to be able to learn more about life after campus life. For me, my background, I graduated in 2016, a bit through and through. That's where I started my medical career. I branched out into VMMC, which is voluntary male medical circumcision, and also did some primary practice work in GP practices from about 2017 to 2018, where I landed myself here at Wits as an associate lecturer and soon after the DICAP coordinator. That basically means I'm a medic who dabbles a bit in technology. So I run the electronic logbook project that the students use to track their patients, their hours, and well, most of you know me already, so that's what I'm all about. Recently just graduated from UCT last week, so yes, post-grad life is real for clinical associates out there. UCT is not the end. That is just the first step. That's where we begin. So I did a postgraduate diploma in healthcare technology management last year and graduated last year. And on the news of graduation today, I was at a graduation where two clinical associates were conferred their postgraduate diplomas in business administration. So it's been a really busy day today for clinical associates on the Wits campus and clinical associates in general, because we have owned this graduation season, and it's especially the postgrad side of things. Yes, so the postgraduate graduation season. It's been fantastic to see. Currently, like I said, working with the e-logbooks, but healthcare technology is where I'm leaning onto more. So it doesn't always have to be clinical. And as I mentioned earlier, I was attending graduation from the Department of Commerce. And that's the last place you'd think a clinical associate would be. But there we are. So moving along to our guests, now that I've gone on and on about me, we have clinical associates and we have Dr. Trevor, which I'll tell you more about. Let's jump straight into it. Our first guest will be Megan Richter, one of my previous students as well. She began her career, of course, finished her matric in 2020 in Pretoria at Mount Edmund. And over the next 3 years, she completed her BCMP degree with us at Wits. And right now, she's currently working as a clinical associate in aesthetics. Nope, it's anesthesia. That's the one, yes, actually, anesthesia, not aesthetics, which we do have clinical associates in aesthetics, but that could be a question for later. So yes, she's working in anesthesia with Dr. Trevor. About Dr. Trevor, Dr. Trevor graduated from Wits with his MBCHP, and he's currently the founder of a clinical ENT treatment. His services are unique because, you know, they have the specialty of anesthesia, which oversees the connection between clinical associates and medical practitioners and hospitals and other medical practices. So he's going to tell us more about that. And his practices ensures that the needs of both the medical professionals and the patients are met with utmost care and attention. And as a specialist anesthesiologist, I got it right this time, he first worked in the public sector and then went on to the private sector. And it's going to be very interesting for us to learn about the differences between working in the private sector and in the government sector, which is also applicable to clinical associates. All right. I'd like to thank our guests again for joining us. Thank our guests, our students as well. They are guests, yes, for joining us. And then I think we can jump right into it.
Hi, everyone. Okay, so my name is Megan. I'm currently working as a clinical associate in anesthetics with Dr. Blumenthal, and this is in private practice. So a little bit about me. I matriculated from CBC Mount Edmund Pretoria in 2020, and I immediately started studying BCMP in 2021. Um, yes, it was my first choice. I know it might be a bit weird to some people. My second choice was biomed, and my third was audiology. But I'm actually happy that I ended up here in BCMP. So I graduated last year in December of 2023. And then in March of this year, I started working for Dr. Blumenthal um, at Millpark and Linksfield Hospital in Johannesburg. So basically, at the moment, I'm assisting him in theatre as well as in his clinical associate recruitment company. Um, yeah, but I think we'll talk a little bit more about my role in that a bit later. So currently, my role in the clinical workspace is to prepare theatre, carry out pre-operative assessments when Dr. Blumenthal can't, assisting in sedations and general anesthesia. So, for example, this would be setting up IV access, helping administer the induction drugs, or managing the airways. Um, I assist Dr. Blumenthal in monitoring patients intraoperatively or throughout whatever procedures we are doing at that moment. And then we, as a team, well, we take the patient to recover and hand over, or we prepare for the next case. And then there's always admin. So when we get a chance, we catch up on some admin and stuff like that. So Dr. Blumenthal and I will switch responsibilities every so often. So when he's available to prep theatre, I might go do pre-operative assessments, or I might prep theatre and he might do the pre-op assessments and stuff like that. So yeah, we work together as a team. And then just some personal achievements. So I haven't been working that long. I've only been working about a month or so. So it's hard to pick out personal, professional achievements, that is. But these are just a few that I've kind of singled out. So, first of all, getting a job. And second of all, getting a job that I love doing. I absolutely love the work that I do with Dr. Blumenthal, and I couldn't be happier having ended up where I am at this point in my life. Um, Being able to grow my network and work with esteemed surgeons. So this is mostly because of the connections Dr. Blumenthal has, um, but it doesn't change the fact that this is a great achievement. Yeah, building your network is such a big thing, especially professionally. So having this opportunity, I think, is going to help. Well, is going to help me in the long run, you know. And then being a part of the clinical associate recruitment with Dr. Blumenthal, not being stuck to doing one thing um, is, I don't know, quite stressful sometimes, but quite rewarding. Yeah, because on the days that I'm not doing clinical work, I'm able to help Dr. Blumenthal with clinical associate meetings and stuff like that. So yeah, and then being able to inspire future clinical associates with what I'm doing. This is more linking towards the recruitment side of things. I can share where I've ended up, and how I got there, you know. And I hope just at the end of this, you also feel a bit more inspired from where I've ended up, and not how easy, but um, yeah, just being able to have ended up where I am at the moment. And then just some challenges that I've faced recently, I guess. Well, like I said before, I've only been working for about a month or so, so having to pick out challenges that I've experienced in the workplace has been quite difficult. So I think these are just one or two that I kind of felt were the biggest challenges along the way so far. And I have no doubt that there's going to be more coming. Um, yeah, I think that's just life. But all right, so some of the challenges. I found that finding competent clinical associates who are professional or carry themselves professionally and in a mature manner is a bit difficult now, especially with the recruitment side of things. Having competent, professional, and mature clinical associates to recommend to doctors who want to work with clinical associates is quite difficult. Um, there's been instances where the clinical associate is very competent to do the job, but don't carry themselves as professionally and as mature as they should to be able to get that specific job that they might be wanting to work in. So I think that's quite a big thing that we all need to work on, is a bit of professionalism and carrying ourselves a bit more professionally. And then this is more a personal thing, but finding a good work personal life balance is sometimes a bit difficult. I personally tend to throw myself into one specific thing. So in this case, it would be my job. And because I throw myself so fully into the things that I do, I tend to forget to balance myself out, and I forget to focus a bit more on other things that would help me grow personally and stuff like that, you know. So yeah, I think everyone tends to do that a little bit. So maybe something we all need to work on again as well. And then lastly, my message to you, and I think this is the biggest part of um, my talk now. I'm very passionate about BCMP and what clinical associates can do, and it's frustrating to see when other people don't have the same passion. So this is, I hope, um, recenters you and maybe gives you a little bit to think about where you're going to be and how you need to approach the next 2, 3, 4 years of your life. Yeah. So firstly, don't get caught up in the negativity of second and third year. Um, a lot of people are going to say that BCMP and third year or afterwards is going to say to you that BCMP was a waste of 3 years, and they regretted studying it because they haven't gotten anywhere with their profession. But you need to be reminded that this is your career. It's not your friend's career. So don't be peer pressured into not enjoying something that you do actually enjoy. Be true to yourself and yeah, focus on your own journey. Yeah, like I've mentioned in my slide here, we have great value in the workplace as clinical associates. Everywhere I've gone, I've been thanked by the doctors and the nurses alike for doing what I do. Um, you know, as clinical associates, we make our own lives easier. We make doctors' lives easier and nurses' lives. So yeah, we do have a very valuable place in the workplace. Yeah, and this again, remember that it's not, if you enjoy the clinical space, and your friend doesn't, then that's perfectly fine. Not everyone is the right fit for clinical practice. So don't try not to be influenced by your friends not enjoying the clinical space as much as you might. Yeah, this is all about finding your place, finding your passion, and finding where you want to be. This is about finding your career. Yeah. And then secondly, the work you put in is the work you get out. A lot of the times I've heard in BCMP is, but the interns get placement, we don't. Basically, stop comparing BCMP to other courses. Every single course has their difficulties, every single course has their issues, and life and things in life aren't going to be handed to you. You need to work to get where you want to, and you need to know where you want to go to get there. Right. So you need to work for where you want to be. Let your passion guide you. If you feel like you have a specific practical that you really, really enjoyed, then go with that. Try and explore it as best as you can. And then I think the last thing is that I want to focus on is that clinical associates can do anything. You are trained to work in every department that you do your practicals in. We may not do as many specialties as, let's say, interns would. We don't have the opportunity at the moment to study a specific specialty. But that shouldn't stop you from getting where you want to be. Like for me, example, um, there was no postgrad that allowed me to study anesthesia, but I found my passion in anesthesia, and I'm very grateful to have ended up where I am because of this. But not having done a postgrad in anesthetics didn't stop me from telling Dr. Blumenthal, no, I don't want to I'm not going to take the job because I don't feel competent enough. I mean, you have your 4 weeks of the specific practical to explore it and become as competent as you can in that specific department. So when you graduate, you are competent to go and work in any field that you want to. Don't feel that because you haven't done a postgrad, you're not allowed to work in that department and so on. Eventually, when you do get into that space, there's going to be extra training involved and stuff like that to really get you to know your role and your job. So your education your education shouldn't stop you from going for a department that you really, really want to get into, And if you feel that being in the hospital isn't for you, you can still use this degree. You can still make the most of it. There's a few people in our class, well, in our graduating class, that have gotten jobs that aren't in the clinical field. I know of one girl that's working currently in medical technology. So, and she got her job immediately after she graduated. So, yeah, it's all about the work that you put in. You can't wait for jobs to be handed to you. You've got to go out, search for them, and apply for as many as you can. And yeah, just don't get, yeah, basically, in summary, don't get caught up in other people telling you that you're not valuable in the workspace, or this course isn't going to go far. What matters is what you do with your career, with your degree. It's yours, not anyone else's. Yeah, and I think that is I have to say today. I know there was a lot, but I hope I hope what I've said, it gives you a little bit of a thought, something to think about. And yeah, I hope everyone is feeling a bit inspired. Yeah, and I think that's all. Thank you.
Thank you, Megan. That was very, very insightful. Um, Next, we will hear from Dr. Trevor, which you've introduced a little in your segment, and we can't wait to hear more about him. Over to you, Dr. Trevor.
Hi there, everybody. Thanks for having me on your webinar tonight. It's nice to join you all, and I'm really glad I can be part of this journey with you all. I hope I can be. Okay, so just a brief introduction of who I am. So as briefly introduced earlier, I'm a specialist anesthesiologist. It was a long process for me because when I finished high school, I didn't get straight into medical school. I did a BSc, I did my honors, and then I got into medical school. I then graduated in 2011, and then started the process of trying to find a post in anesthesia. So I did some ICU time, did my internship, obviously, then did ComServe ICU time, and then went and did a diploma in anesthetics, and then eventually got a specialist post, which allowed me to specialize in anesthesia. Specifically anesthesia, because I really quite like the physics, physiology, and pharmacology of the field. It really does encompass all of that, and it allows me to connect with my patients on the pre-op and post-op level. And also, if in terms of, I'd say a vast majority of the time, patients are coming to theatre to have their health improved from a surgical point of view. So it's nice to usually have a nice outcome for these patients. I have to say that I was introduced to clinical associates probably in my fourth or fifth year of medicine, when I was working at a local clinic. And I'd only really touched base recently again with clinical associates, and working and seeing the role that clinical associates can work even in the private sector is quite something. I'll go a bit more into that shortly. But as Megan alluded to, that we've started this clinical link recruitment where I'm trying to connect clinical associates in the clinical environment. That's for now. Who knows? Perhaps at a later stage, I can extend out to maybe your business models or even your research side of things, because I'm involved at a specific list at Milpark Hospital, where it's actually run by, the list is Professor Carol Ben. I'm sure a few of you know Prof. Ben, where we do quite a bit of research, and that might be a specific role someone might be interested in. But as mentioned, the role is to connect. Currently now, it's in the infancy stage, so I'll go into get a bit more in the next few slides, but linking, as mentioned, clinical associates with the clinical setting. All right, so again, what are we about? Being a specialist anesthesiologist, I'm working with Megan now, who's a clinical associate. I'm trying to bridge that gap between doctors, specifically allowing doctors to know the value of clinical associates. Just giving you some anecdotal history and background. I work at specific hospitals, and there's immense frustration I deal with a couple of my lists where I have an anesthetic sister who helps me, but to their credit, sometimes they're thrown in the deep end. And unfortunately, sometimes I have a very straightforward list, which is pretty easygoing, and then sometimes I'll have a very critical ill patient. And at that point in time, it can be very stressful and frustrating, where my anesthetic sister doesn't have the clinical acumen and hasn't really rotated through anesthetics as you guys have, as interns have, to help me deal with these cases. So now dealing with Megan and having worked with Megan and training Megan, it's changed my life in many ways, from just being rest assured that should I miss something, Megan can pick it up. And also just having Megan have my back when it comes to a difficult airway. Megan, if I need to go get something, Megan will be able to bag mask, ventilate, and just going through the ropes of that. And then the role is that I'm trying to also match skills of the clinical associate, as well as the personality of the clinical associate to the working environment. So what I mean by that is, some as alluded to, clinical associates may not want to be in the clinical realm of their careers, and hence, it would make sense, even though a lot of people are looking for work and jobs, you don't necessarily want to take a job just because it's a job. I know times are tough, things are stressful, we have expenses, but I always feel that should you enjoy what you do, you'll never have to work a day in your life. And then just going on to the whole clinical link recruitment once again is, what I like to do is I have a pre-interview with the clinical associates. And why I do this is that I and Megan will be in this interview, is we screen the clinical associates. And why that's important is because, again, we want to match the clinical associate to the surgeon. So I'll have an interview with the surgeon or the physician or the GP and see how it would link with a specific associate. So I've already interviewed a couple of associates, and we've got a little a spreadsheet of their specific interests, who they want to work with, and we take it from there. Right, so what about you? So that's where I was, right? So finding your field, knowing what you want. So what I mean by that, again, is go into your careers and jobs, and I want you guys, to see it as a career, not as a job. It's very different. Everybody can have a job. I suppose I'm just giving an example here. Being a delivery, nothing wrong with being a delivery, a career service. That's more of a job. You're not going to improve yourself in terms of making a career out of it. And I think that's the crux of a lot of this, by finding what you're interested. So Megan was really interested in anesthesia, and hopefully Megan will make a career out of it. And I think it's the same with you guys. Find something you're really interested in. Don't just settle for any job that comes up, because you won't be happy. You won't want to improve yourself within that career. And that's where research comes in. So research into what the different specs are. So what I mean by specs is whether it's surgery, whether it's anesthesia, whether it's emergency medicine, look for courses that could extend your skills. So it doesn't make sense, if you want to do research, be a clinical associate in research, to go and do an ACLS or a BLS course, right? Look at doing a research course. And when it comes to applying for jobs, that's what's going to count. So you want to make yourself stand out. And by having these courses in those specific fields, it's going to make us look at that, and obviously all your potential employers. So look for workshops. I'll get into a bit more on that later. And then professionalism. So as I saw right there, dress to impress. Always, whenever you have an interview, whether it's in person, obviously you're in person, dress to impress as though it's going to be the job of your life. Okay. And when you have a Zoom or a Microsoft Teams interview, always make sure your camera is on. It gives the interviewee or your potential employer an idea of how professional you are. I've done a couple of Zoom sessions where I haven't been able to see the clinical associate, and it just doesn't give me a good idea of the level of professionalism and the maturity. So that's obviously important when it comes to applying for a job. And then make sure your CV is up to date. Make sure that you've proofread your CV. I've noticed a couple of mistakes in some CVs where dates have been wrong, where it's obviously been a generic CV, which is all perfectly fine, but just make sure that isn't there, because when I'm going to read through it, which I will read through it before I'd say send it on to a surgeon or a physician or whoever it is, I'm going to look for these things, but make sure it's more professional. So you're setting up yourself for success, because that's going to be a little bit on the side of being more slack and not really paying attention to detail. And as a anesthetist, I'm sure you've heard we're quite A-type. So that's very important for say anesthesia, in that we need to see that the details there, and it should be with any job you do. Yeah. Right, where to from now? So we have a website, Clinical Link Recruitment. It'll be on the last slide, where you can fill in a form and just send your CV through. Make sure your CV is ready. Look out for courses. So even if it's a nurse course, all right. So for example, there's the South African Society of Anesthesiology. There's a congress in September, and unfortunately, there isn't quite a bridge between the nursing course and the specialist anesthesiology congress and refresher. So, even apply for something like that. You'll get CPD points, which you do need anyway. Megan's going to be going to potentially going to come to the full congress, but may attend the nurses course just to get those skills for in theatre. Then looking at private versus government. So that's a very, very different ball game altogether. You'd be surprised, though, that there are still a lot of frustrations that you would have in government that you still have in private. Unfortunately, I'm not too in touch with the government setting regarding clinical associates. I will try and contact the hospitals at some point and see how we can bridge that link again with clinical associates, because some clinical associates may prefer the government setting, clinic setting, as opposed to working in private hospitals from that point of view. As mentioned, we're still in the early stages. So if you can send your CV and your all your details through on our website, Megan and I are formulating a list, and we want to categorize clinical associates into their field of interest. So once a surgeon or a psychiatrist or a GP contact us, we'll be able to say, okay, good, we've got this link, this list of associates who are interested in this specific field, and we're going to contact them and send through their CVs. I made this note over here that I will be approaching the College of Medicine of South Africa to try and introduce these specialist post-degree courses. So, for example, in anesthesia, there's a diploma in anesthetics, which I did, and I would like to try and get that from the anesthetics point of view for clinical associates. In America and a lot of overseas countries, they have what's called an anesthetist. So say, for example, in America, you have what's called the anesthesiologist, which is the specialist doctor who did anesthetics as a specialty. And then you have your anesthetist, which is like your anesthetic nurse. But again, I think that's where the clinical associate comes in, because they almost have a specialist field within that course. So I'm going to try and approach the College of Medicine regarding that, see if it takes off, and we can try and then introduce other specialist courses or diplomas for clinical associates. And then, as mentioned, try and look out for these congresses that are out there in this field of interest, because also it's a good way to network. When you go to these congresses, you'll meet surgeons, you'll meet doctors, there's family physician conferences, there's clinical research conferences. Look out for these, go to them, and it's just a good place to network. Right. This is the last slide where you can see this is our website. I'll leave it up for you guys. I can share it on the chat where you can have a look at what we do. And then if you need to contact me, that's my number you can get hold of me on. I think it looks like a digit short. Sorry about that. And then there's Megan. I'll also put my correct number in the chat.
Are there any questions? Please do type it in the chat space. But perhaps I can start. I think that the partnership and the relationship between the clinical associate and the specialist, it's something that is happening overseas, and it's so critical for the success of the work that needs to be done. So how has the task sharing or task shifting sort of panned out, or are you still exploring that space? We can start with Trevor and then Megan.
Sure. So yeah, look, it's been an interesting experience for me. I've always really liked teaching though. So for me, even when I was a registrar having interns, I was very open to allowing people to learn and take on some responsibility. I feel that everybody needs autonomy. I feel like everybody should be learning, and you don't learn by watching the whole time. You've got to be involved, and it also motivates the person you're working with. And also in the environment I like to work in, that everybody is on the same footing. So yes, there is that, unspoken respect that is between nurses and doctors, but I feel by removing that, you allow things to run a lot smoother. So with that said, I feel, I feel Megan's has taken on her role very, very well. I feel like I've let Megan do a lot more and not hovering around all the time. But I feel confident after having taught Megan a lot of, within theatre and coming with the skills she has and her enthusiasm. It also allows me to let her do a lot more and take it from there. Yeah.
Thank you. And I think that it makes the trust, she obtains the trust a bit more when there's enthusiasm and that willingness to expand her skills. Megan, from your side?
I think from my side, just with the to comment on the task sharing side of it, I think we're still very early on. So like I said, I've only been working for about a month or so. So every step of the way, we kind of just feel out what's happening. So I think Dr. Blumenthal and I work together quite well as a team. So being able to read each other and for me to know what Dr. Blumenthal requires, I think we've been doing quite well on that. So, I mean, if I get there very early in the morning, I know that theatre needs to be prepped. So there's no use in me sitting around waiting for Dr. Blumenthal to get there when I know what needs to be done and I can do it ahead of time. So just from that standpoint, knowing what we need to do and then seeing what's being done, what still needs to be done, I think that's kind of how we've been going about it. But it's kind of feeling our way through the day kind of a thing. Yeah.
Yes, yes. Okay, okay. There is a question. I'll start with the very first one. Ayanda is asking, Dr. Trevor mentioned something about the Congress. I'm sure this is, the conferences.
Sure. Okay, so look, I think it might be a bit easier for me to see because I'm part of SASA, which is the South African Association of Anesthesia, so I get an email. What I will try to do is on the Clinical Link Recruitment website, I can post a page on congresses that are out there. Obviously, there are fees with a lot of these congresses, but again, you would have spoken to, say, for example, SASA, and that you can register for the student where you get good discounts, and as well as the nursing refreshers, but I will try and post them on the Clinical Recruitment website. You can even Google them. If you look at all the different associations, you should be able to find them there.
The next question is about the success rate of the placement of clinical associates from the company thus far, or the organization.
All right. So as Megan and I both mentioned, it was very much in the infancy stage. So how it works is that you guys, the clinical associates, just send through their CV. There's no cost involved to you guys. You've maybe just currently placed one or two people, but obviously it helps when I have a lot more, clinical associates part of that list. So I can go out and say to the surgeon or physician, whoever it is, I've got a list of the clinical associates. I've screened them. I've spoken to them. This is my list of 3 candidates for you, because I think it works a lot better when I've screened, and Megan and I have screened these clinical associates. The potential employer has now got an option of 3 and doesn't have to go through the whole process. So the more that that you guys sign up to the website, the better.
Then I'm going to maybe summarize a bit of there's good ideas coming from the chat space to say, I was wondering if we want to work in private, would you recommend we try and do our elective in private? And would there be an opportunity to possibly work with the clinical recruitment link? So almost like to have a channeling in from the student phase through to graduation, but that might be a future sort of idea. To see if there is a match with the doctor ahead of actually getting a job. Not sure if I'm making sense. Yes, Cassandra, you are making sense. Then there's another question about, do you place out of Gauteng, or is that something you're looking into?
Yeah, so it's definitely something I'm going to be looking into. Again, when you submit your form, you'll be able to state in terms of where you're from, where you want to be placed, and it's difficult in terms of getting the medical field out there to know the value of you guys, because as I said, I feel there's a very strong value for clinical associates, and I just need to show the rest of the medical fraternity your value. So I'm certainly trying hard, and all my surgeons that I work with have seen how great Megan's been, and definitely the value that she's shown to me as a doctor.
Yes, thank you so much. We love to hear that. We really do. Then I think the last question I'll ask Megan. You spoke about networking being so important. What have you seen? You're a recent graduate, recently out of the box. What are some maybe key pointers that you can give students?
Okay, so from a recent graduate's point of view, I saw with our class, everyone tries to get themselves out on LinkedIn like a lot. A lot of people start following each other, connecting with each other on LinkedIn straight out of graduation, which isn't a bad thing, because you then have the opportunity of boosting each other's posts. And if there's someone you know who's looking for a job, you've seen it. If you see a job that lines up with what they're wanting, there's the possibility of you can recommend that person for that job or something like that, or let them know there's this opportunity that I've seen. I suggest that you, for instance, apply for it and see what happens. So a lot of networking happens on LinkedIn. I would recommend that everyone gets a really good LinkedIn profile, updates it, and keeps it updated. Because I think that's also one of the biggest platforms where recruiters will find you. I mean, that's where Dr. Blumenthal found me. He'd taken a look at my profile, sent me a message saying, listen, I've got a recruitment site. Would you be keen on sending your CV in? And it just so happened that he was thinking of getting a clinical associate. So I went for an interview, and that's how I got where I am now. So I would really recommend everyone gets a good LinkedIn and keeps their LinkedIn updated, because that's where a lot of people will get their jobs from. But there are other sites out there that you can try and get your CV out onto. There's a lot of medical-based recruitment sites as well. Biased, I'm going to recommend Clinical Link. But there are others out there, so yeah. For me personally, what I did is I tried to get my CV out to as many places as possible. I used my personal connections, like people that I knew who were going into hospital or had just come out of surgery and stuff like that. And it sounds a bit weird, but I'd tell them that I'm looking for a job, give them my CV and ask, would you mind forwarding it to your doctor, or could I possibly get the contact details for your doctor so that I can contact them and just express my interest in a job, So I think that's a good place to start, is your personal connections and LinkedIn. But your networking, try and contact as many people as possible, especially once you've graduated or before you graduate. There's nothing wrong with trying to secure yourself a job before you graduate, but as long as you're transparent and you say, listen, I'm graduating, or I'm hoping to graduate in December, I can maybe start after that, etc., etc. Yeah. I hope I've answered your question.
You did. Thank you. I want to say thank you to each person. To Trevor, I want to say yes, thank you so much for just realizing clinical associate potential. I think there's a lot that still has to be done in South Africa, and there's different models in the African countries, in America. We now need to figure out what's going to work in South Africa. And need a diverse team of people. So I get so excited when there's other professionals who are actually vouching and see the value of clinical associates, aside from just clinical associates. So I appreciate you coming in. Thank you so much. To Megan, thank you. Your story is just starting, and there's so much ahead. There's so much potential. It would be nice to get you coming again to see how much has she now grown into the space. So I really appreciate it. And there were a lot of hearts and applause. I don't know if you saw them at the end of your talk. So thank you for jumping on. And to the students, 45 people I think stayed behind, and it's supper time. So thank you for them for just popping in. But thank you so much to everybody. Please have a good evening, and we'll meet again. We'll meet again first Monday of every single month, and we'll keep pushing.